Hi, my name is Dr. Schlang, and I'm Chief Dental Officer of Smile America Partners. And I'm making this video to go over our epinephrine ampules and what you will need to do if a child should go into anaphylactic shock. Anaphylactic shock would be a very unusual thing to happen, but it could occur, and it can occur over any antigen that may cause the body to go into an extreme overreaction to that antigen. And the antigen could be pretty much anything. It could be food, it could be a bee sting, it could be lip gloss, it could be even lidocaine, even though it's extremely rare that anyone is allergic to it. It has been documented. So if a child should go into anaphylactic shock, in our emergency drug kit, we have 4 ampules of 1 milliliter epinephrine. And these are the ampules in their casing. We have 21 gauge 1 milliliter syringe needles. And we also have filter needles. Now, I did a video a couple of weeks ago that was posted, and I showed how to draw the epinephrine using a filter needle. The filter needle is supposed to prevent glass shards which breaking off the top of the epinephrine vial from entering into the needle and being injected into the arm with the epinephrine. A couple of emergency room physicians saw the video, and they told me that it would be a really good idea if I made a video without using the filter needle, because in an emergency situation, even though anaphylactic shock doesn't always happen immediately, it can occur immediately, and the quicker you react, the better. And so let me first go over what would some of the symptoms be. Low blood pressure, so the child would be kind of faint, weak pulse, and in anaphylactic shock, the danger is the airway swelling and not being able to breathe, so it would be difficulty in breathing. And simultaneously, it seems that the lips and the tongue swell, and hives occur, and the itchiness from hives occur. So if all of that is happening rapidly, you would call 911 and immediately prepare an epinephrine syringe and inject it into the child to help overcome the anaphylactic reaction. What I'm going to do is to show, without using the filter needle, to how quickly you can react and get a syringe of epinephrine prepared and inject it. So you would remove the ampule from its case, tap on it to make sure that the epinephrine has gone to the bottom of the ampule, grab a 2x2, break off the top away from you, open up your syringe, and you remove the needle casing, and you can turn your ampule of epinephrine upside down without fear of it falling out. Insert the needle a couple of millimeters into the epinephrine and draw out approximately a ½ millimeter of epinephrine. Now, for children who are 6 years age or under 60 pounds, the proper dose is 0.15 milliliters of epinephrine. For children who are over 60 pounds, the proper dose is 0.3 milliliters of epinephrine. And one injection of epinephrine may not be sufficient, but if you should simultaneously be on the phone with 911 or your assistant on the phone with 911, and with the paramedics coming, they can advise you if in 5 minutes or so, if another one, if you need to give another one. Anyway, when you draw the 0.5 milliliters of epinephrine, there'll be some air bubbles. So you tap on the syringe to get the air bubbles to rise to the top, and then press on the syringe to the appropriate dose. And I'm going to stop it at 0.3 milliliters. And you'll see that the epinephrine has extruded from the end of the needle. Now, I'm going to recap the needle with one hand, and I'm going to demonstrate what would be the proper technique to give it in the deltoid. Okay. Now that I've drawn the 0.3 milliliters of epinephrine, the only thing that needs to be done to inject it is you can grab the upper portion of the deltoid, tent it, and perpendicular to the deltoid, insert the needle all the way, the full inch, so you can be sure you have an intramuscular and not subcutaneous injection. Make sure that blood isn't coming back into your syringe, and simply press the full amount in. After that, you should have the child in a reclining position. You may want to have the child on oxygen and keep in close contact with the EMTs who will be coming and the 911 operator. Thank you.